Brett, thank you. And just 5 minutes ahead of a planned vote to repeal and replace Obamacare, President Trump's American Health Care Act was abruptly pulled from the House floor. The Republicans' plan to end Obamacare came up short. Speaker Paul Ryan canceled the vote because it didn't have enough Republican support to pass. This is a major setback for President Trump, who campaigned on a promise to repeal Obamacare. The Affordable Care Act now remains the law of the land for the foreseeable future, the president refusing to see it as a loss.
Perhaps the best thing that could happen is exactly what happened today, because we'll end up with a truly great health care bill in the future after this mess known as Obamacare explodes.
I will not sugarcoat this. This is a disappointing day for us. Doing big things is hard. All of us, myself included, we will need time to reflect on how we got to this moment, what we could have done to do it better.
Thank you, Mr.
A close vote on health care is nothing new. Back in 2010, the Affordable Care Act passed the House with only 3 votes to spare. And we wanted to know what Rochesterians are saying about the failed American Health Care Act. Lynette Adams joins us live in downtown Rochester with local reaction. And Lynette, what are folks saying?
Well, Jennifer, like people across the nation, people right here in the Flower City have mixed emotions about what happened this afternoon on Capitol Hill.
I think it was probably a good thing that it didn't pass today.
Chuck Hinkle runs a small advertising and marketing company. He spends $7,000 a year for health insurance. He wants to see changes in health care to ease the cost of coverage. But he says the American Care Act is not what he has in mind.
You know, it didn't really save money for people right away. It was 5 or 6 years down the road, so there really wouldn't have been an impact right away. So that makes it a little bit of a hardship for people like myself who are employed, self-employed, and really paying the full bill for health care.
For the amount Hinkle spends, he doesn't have eye or dental coverage. So he hopes the conversation continues despite the decision to drop the American Care Act. This Penfield resident is disappointed the bill failed to make it to the floor for a vote.
Yeah, I think what was started was it was supposed to make some improvements, and I think not passing anything just puts us back to where we were, which didn't work in the first place.
Trish DiStefano of Greece sees both sides of the debate.
Well, working for the healthcare industry, I mean, it is great that we do have something that is affordable for people, but it does drive costs up as well. So, I don't know where the medium is as far as how to get that to balance out.
What everyone expressed to us tonight, they want coverage that covers every American, but not at the expense of some Americans. We're live downtown tonight. Lynette Adams, News 10 NBC.